Okay, so I am creating a ball and socket synovial joint, which includes the humerus, the arm bone, and the clavicle, the shoulder bone. And after this stuff all dries, I'm going to use pipe cleaners and different colors of clay to add the ligaments and tendons on it. And I have a bunch of different sources here, textbooks that I got from the library, pictures that I printed off to help me figure out what they look like, and I'm going to try and add the landmarks on with the different processes and everything, and hopefully they look accurate.
Good.
So for my cartilage, I am using the bottom of chair stoppers because I didn't have any extra glue. So I'm just going to glue pipe cleaners around the edge of them to kind of signify that they're the cartilage, and then I'm going to stick them where the joints go, basically, so the head of the humerus and in the glenoid fossa. And then once I get those done, I can add all the tendons and the muscles and the ligaments. And for now, I will point out, on my bones I tried to include the landmarks. So on the humerus, I tried to point out, so I have the neck here, the lesser tubercle here, greater tubercle here, and this is the head, which is going to insert into the glenoid fossa of the clavicle. And on the posterior side of this, I have the head again, and basically the neck. And there are more landmarks on the scapula. So I have the acromion, the scapular spine, which is that here, the supraspinous fossa, and the infraspinous fossa here. And on the interior side, I have the subscapular fossa. It's supposed to be a little indent right here. And I have the coracoid process right here. And I didn't attach the actual clavicle onto this just because it would have been a lot, but there's a clavicle here. So those are the landmarks that I tried to include. You can stop. Now I'm adding my tendons. I have all the cartilage done, and I have the bones are all hardened and stuff. So with the tendons, I'm using red pipe cleaner, well, not red, but an assortment of different pipe cleaners to show each of the glenohumeral tendons for this main part, and I'll be using another color pipe cleaner to do the other tendons, just so that I can keep track of which is which. And to add the tendons, I'm just poking holes into the bone, I guess, into the clay, and then I am taking the ends of the pipe cleaner and putting them on the bone to show the tendons, basically. And after they're all added on there, I'm going to show how each of the tendons move the bone, basically. So, yeah. And my bones are all hardened, and I've added the ligaments on. To kind of, I didn't label the ligaments. I used different colors of pipe cleaners to kind of, so I know which ligament is which. And to start off, the ligaments surrounding the capsule here, so the red, the blue, and the green ligaments, they're all part of the glenohumeral. They're all glenohumeral ligaments, and they make up the capsule surrounding the joint where the humerus and the scapula meet, basically. So the red ones I have are showing the superior glenohumeral ligaments, and these support the full adduction of the arm. And to demonstrate with that, the pipe cleaners aren't as supportive or versatile as normal tendons in the body would be, but I tried my best. So full adduction of the arm would be raising it and lowering it, and bending like that. And then the blue tendons that I have here, they are the medial glenohumeral ligaments, and they support external rotation of the arm. So if you're looking from the posterior side, it's gonna go outward like so. I don't know if you can really see that very well, but it's gonna move like this. And then the last glenohumeral ligament is the inferior, and there are two bands of that, the anterior band and the posterior band, and they both also support rotation. So the anterior band also supports external rotation, so like so. And the posterior band of the inferior ligament does internal rotation, so it moves as so towards the inside. Okay, and then I have the coracohumeral ligament. Yes, and so this ligament, it doesn't really have a lot to do with movement. It strengthens the upper part of the capsule, basically, so it attaches the head of the humerus and the lateral border of the coracoid process. And then that's the purple one that I have here, and then this orange ligament that I have here, which attaches the acromion and the coracoid process, is the coracoacromio ligament. And this also does have not as much function involving movement, but it does form a vault of protection for the head of the humerus. Okay, so those are the main ligaments for my joint, my shoulder joint. And move on to the muscles, I guess. So, you can stop there. Bursa, located on the shoulder joint, and it's a small fluid-filled sac that acts as a cushion between the bones. So it's right under here, under the acromion. It's called the subacromial bursa. So that's there. And the cartilage that is between the humerus and the glenohumeral, or the glenoid fossa, it's a special kind of cartilage called hyaline cartilage between the joint. So the muscles that make up my joint are, there's quite a few of them. The supraspinatus muscle, which helps with adduction of the arm, abduction, sorry. The infraspinatus, which externally rotates the arm, and the teres minor, which also helps with externally rotating the arm, and then the subscapularis, which internally rotates the arm. So all of these four muscles also make up the rotator cuff, which is basically the whole joint, and it's just a group of muscles as well as tendons, which is the tendons I have here, that act to stabilize the shoulder. And there are also pretty severe injuries that can come with straining or damaging the rotator cuff, in which case there's different treatments you can take, cortisol supplements, and physiotherapy for one, and just not using it and straining the muscle even more. There's other muscles as well. So on the posterior side is the teres minor, which is used to externally rotate the humerus. So that's a little more off, away from the joint. The deltoid muscle, which is also predominantly used for rotation. And then on the anterior side, so it's going to be on this side of it, the infraspinatus, which I already mentioned, which is it's triangular muscle and it's attached to the infraspinatus. Some of the injuries that can go along with the shoulder joint are mostly it's just straining and tension, and it can hurt the muscles. mainly instability, where the joint is moved or forced out of its normal position, or otherwise known as like dislocation. And to fix this, you would obviously have to get it put back into place, and you would have to probably go to physiotherapy for a little bit to make sure it's all rehabilitated properly. And next, there's impingement, which is caused by excessive rubbing of the shoulder muscles against the acromion, which is this thing right here. So I guess that could be pretty painful because it's kind of pointy. And if you don't get that treated, it can lead to a more serious injury. I'm not sure which, but you just would have to be careful with that and make sure you get it fixed when you notice something's wrong. Most of these injuries, they can be detected by pain or issues in moving your keeps cutting off, but that's pretty much it for the injuries. It's mostly just excessive strain of your shoulder, in which case you would have to go for physiotherapy or to just get it rehabilitated. So that's about it for my presentation. For my sources, I used Functional Anatomy for Sport and Exercise by Claire E. Milner, this one. The Human Body book, which doesn't really have an author, it's just a very informative, large book. And the Sports Medicine book, which is by Gabe Merkin and Marshall Hoffman. And I also used Google Images for a couple of my diagrams and to figure out where everything was, and the material on the website, or on our class website, I guess. All the content there. So that's it for the shoulder joint. Thank you.